I'm Barbara Bush. I am the CEO of Global Health Corps, as you just saw on that video. And I'd love for you to visualize something with me. Visualize in 20 years that health systems on the African continent and in the rest of the developing world will leapfrog over those in the United States and developed countries in terms of quality, accessibility, and system functionality. It will be as easy and socially acceptable to vaccinate your child with a life-saving immunization as it is to top up your mobile phone plan. And the status quo will be high-quality, effective healthcare with an emphasis on prevention. Anything less than that will not be tolerated by anyone. And this will not be because we finally cracked the code on cold chain storage in remote regions, or because condoms, bed nets, and community health workers have reached the furthest villages. It won't even be because women and girls receive the full rights that they deserve. Yes, these will all be part of the solution, but this leapfrogging, this transformation, will be due to the infusion of radical new leadership from this generation's youth. Millennial man and woman power. I'm going to take a quick moment and state the obvious. Everyone in this room is extremely accomplished. I'm very nervous to be talking to you to begin with. You have accolades upon accolades and wins of every shape and size beneath your belt, and each of you carry tremendous responsibilities on your shoulders. I am ever grateful to consider you partners in this work, and I'm about to cry, which is typical in front of strangers, because I am so grateful that you have all worked so hard to move the needle on issues that matter to people around the world. Each of you deserve the respect and accolades that you have earned, and much, much more. You have letters that come after your name. Many of you have letters that come before your name, and you have done tremendous work. But I hate to break it to you, you and I will not be around forever. Time moves forward, technologies will improve, and the global health and economic development landscape shifts. And there will come a time when each of us will need to step aside. And who are we mentoring to take our place? What type of leader will she be? What is the vision that she and other emerging leaders will move us towards? In 2009, 5 other 20-somethings and I co-founded Global Health Corps to answer these questions. We have been motivated by the belief that great ideas don't change the world, great people change the world. So every day, we invest in great people. We worked alongside our incredible mentors like Dr. Peter Piot and Dr. Paul Farmer to learn more about the emerging leadership and management gap that exists in global health. And so at Global Health Corps, we're building the next generation of global health leaders to fill this gap. Our leaders share a common belief, and that's the belief that health is a human right. Our leaders would be wildly diverse. They would come from very different places and very different backgrounds, and they would focus on empathy, resiliency, and creativity just as they do business acumen and effectiveness. Our leaders would be highly networked and global because, as we know, illnesses and disease don't respect borders. And they would step up to take the place in the retirement of the wake of such giants. And incredibly enough, Dr. Piot and Dr. Farmer are very comfortable with the fact that we have lined up not just one, but hundreds of young people with the skills, motivation, and desire to take their jobs from them. They are young leaders like Amit Salvi, who I met in 2009 when he joined Global Health Corps. Amit was a recent graduate from UC Berkeley with a degree in engineering, and he had been working for the Gap for 3 years. Obviously, he looked like a global health leader. And he had been overseeing Gap's supply chain. But he had been a social justice advocate since he was a teen, and he was thrilled to realize that his skill set could play a role in affecting change in global health. So he joined us, and he started working on the 2-person drug supply chain team with the Ministry of Health in Zanzibar. And this time, instead of his customers and clients being Gap store attendees, Gap shoppers, they were the 1 million people living on the island of Zanzibar. And now, instead of moving white t-shirts and denim jackets from Gap warehouses into Gap stores across the United States, he was moving life-saving drugs from warehouses into clinics, and more importantly, into the hands of the patients that need them most. And Amit was thrilled to realize that this skill set that he had honed in the private sector could have a much bigger impact in global health. And he's continued to hone that skill set, living in Tanzania and Kenya. And then, when Ebola outbroke, he moved to Sierra Leone, and he oversees the drug supply chain and procurement for Partners in Health. We have been working towards our mission for health equity since 2009 with a lot of bumps and victories and incredible people like Amit along the way. 6 years ago, our team was 2, including myself, and we had 22 very brave inaugural fellows who I kind of can't believe joined us in the beginning because we really hardly had a website. Flash forward, our team is 20 times that size, and we have been lucky to work with 600 exceptional young leaders from around the world. And the way that we work is we partner with existing healthcare organizations, ministries of health, large INGOs, some of which I know are represented in this room, like Partners in Health and Clinton Health Access Initiative, all the way down to organizations working at the grassroots level. And our partners identify the biggest systems gaps that they have. And then we competitively recruit young leaders, 2 of them, to work within the organization filling those systems gaps. Currently, our fellows are working at all levels of the healthcare system in Rwanda, Uganda, Malawi, Zambia, and in the United States, in Newark, Boston, DC, and New York, because of course we have global health issues here. And the way that our fellows work is they participate in what we call our sort of very 21st century wall-less leadership development institute. They are learning every single day, working on complex healthcare systems, growing as leaders by problem solving in gray area. And then throughout the year, they participate in our curriculum, which we have designed in partnership with a lot of great people that are here. We work with the Global Health Leadership Institute at Yale, Harvard School of Global Health Delivery, and we bring our fellows together 5 times a year because it is critical that they make an impact in this first year that they're with us, but we would argue it's more important that they understand systems change and policy, advocacy, and entrepreneurship, that they gain the frameworks and ways of thinking that they need to continue to affect change throughout their lives. And we also bring them together because these 600 fellows are partners in this work. It is not acceptable to bring great talent into a field that needs great talent, only for caretakers to get burnt out. So we work a tremendous amount on resiliency, ensuring that our fellows understand why they do what they do and how they can address challenges to stay in this field. Currently, our fellows in the field right now, they're all 30 and under. It's very generation specific. I aged out, which was a bummer because 30 seemed really old when we started Global Health Corps. It's not that old anymore. They are all under 30. 50% are from the African continent, and 75% of them are exceptional young women. Our model is completely based on supply and demand. So this year, 120 organizations and ministries of health requested Global Health Corps fellows. We will partner with 70 of them. And on the supply side, we were pretty excited when we closed applications 4 weeks ago on February 3rd. We're recruiting our new class of 168 fellows, and 14,000 applications rolled in for those positions. So needless to say, our fellows are pretty great. They are exceptional. They are young rock stars like Nargis Shirazi, who is a Ugandan journalist, maternal and child health advocate, and social entrepreneur. Nargis joined us in 2011 to serve with Millennium Village Project to work on their women's health program. And Nargis is not the type of person that accepts the status quo, and luckily she has the creativity and skills to change it. Growing up, talking about contraception was taboo for Nargis, as it is for most young Ugandans and really most young people around the world. So Nargis set out to start a conversation. And Nargis wrote a play. It was a comedy. And in this comedy, instead of women getting pregnant, men get pregnant. And she performed this comedy throughout Uganda in order to start a dialogue around the role that men need to play in women's health issues. Her play garnered widespread acclaim in Uganda, so much so that Melinda Gates heard Nargis' story, and she met Nargis later that year, and at the end of the year, she wrote a piece, and she cited Nargis as one of the 4 most inspiring women she'd met in 2014. And upon getting that praise, Nargis did not sit back. Instead, she is continuing to run like a madwoman, addressing social justice issues. She teaches public health students in Kampala. She founded the WOMAN Foundation, which creates educational programming around health for youth by youth. And she is currently designing the first ever board game around reproductive health issues to continue this dialogue with youth in Uganda. Nargis is exceptional, and all of our fellows are exceptional, and that's a good thing because The challenges that we're up against, as all of you know, are extremely complex. And in public health, leadership is mission critical. Leadership is what will allow us to fix what has happened in Flint, Michigan. Leadership is what will enable us to understand Zika and get in front of it. It is what will allow us to learn from where we failed in Ebola and get ahead of it. And truly great leadership is one of the most impactful, sustainable levers for change that we have in global health. But not just any leadership, leaders that are adaptive, creative, leaders that focus on putting patients and people at the center of what they're doing and that are as closely connected as to the communities and ideas where transformation is happening. Leaders like Kochilani Sala, a young Zambian entomologist who, before joining Global Health Corps, was studying aquatic insects across Zambia and using that information for an EU-funded study. Global Health Corps was his first step into the field of global health, where he brought his knowledge on insects, his knowledge on the mosquito, to be specific, his ability to get inside of the brain of the mosquito, as he likes to say, to global health, where he joined PATH, overseeing their malaria programs in Zambia. And Coach continues to work in Zambia, where he is working to eradicate malaria from Southern Africa, and he's using his unique skill set to do so. In his end-of-year report at the end of his fellowship, he wrote, "My desire to stay in a field that I knew so little about has deepened. This is my life now." And at a time when Zika threatens and looms, Coach's unique expertise and skill set could not be more valuable. There is not one approach or one skill set that will allow us to affect change, but the sum of the parts can be greater than the whole. And we, every day, work to build a tight-knit leadership network with the breadth and depth and elasticity to address global health challenges. And at each node in our network is a human, is a story, is a person who's motivated to do this work for their own special reasons. And our fellows are really diverse. Many of them do not look like you, and they don't look like me. A handful of them are doctors and nurses, but the rest of them are systems thinkers, and all of them are problem solvers. They are architects, they are communicators, educators, engineers, economists, you name it, we have one of them. They have won African Grammys. They have competed for the Malawi national soccer team. They've given TED Talks. They're exceptional. And our diversity is one of our greatest strengths because, as we all know from problem-solving methodology, the different lenses and the different ways of thinking that we can have at the table addressing issues will lead to better solutions. And they are whip-smart young Zambians like Angel Chelwa, who is a feminist and sociologist who joined us to work for Population Council last year. And Angel used her research background to research the effects of unintended pregnancy and use this research to inform policy with the Ministry of Health. But Angel is an activist at heart, and so after reading about incident of street harassment focused on women wearing miniskirts in Lusaka, she got organized. And she organized a march in which hundreds of people hit the streets to protect the rights of women. They all carried around signs that said, "Don't minimize me." And this march gained national acclaim and regional acclaim, and it actually ended up on the front page of allafrica.com. And Angel realized how impactful her voice can be. So when we brought all of our fellows together last year for their end-of-year retreat, we bring them together 5 times a year, much for the same reasons as we're all here, to learn from each other and figure out how we can partner in this work. We were thrilled to be joined by President Kagame for 2 hours of Q&A on global health and development. And he answered a question on engaging women in leadership. And of course, Angel raised her hand and said, "Yeah, but what about truly meaningful strategies for gender equity?" To which President Kagame went silent and said, "Good point." And Angel is continuing to use her voice, where she will be sitting alongside the Minister of Health in Rwanda this summer at the Women Deliver Conference. Angel, Coach, Amit, and Nargis represent the powerful notion that young people can make an impact in the field of global health now, while gaining the skills that they need to be leaders throughout the rest of their careers. These are just 4 of our 600 people. And we know that with each new class of Global Health Corps fellows we bring to the field, the potential for sustainable solutions grows exponentially, and that is what motivates us every single day. And I don't know how this makes you feel, but this makes me feel very relieved and very hopeful and very excited for what the future will look like, because we know that this network of fellows is just getting started, so that in 10 years, our Nargis Shirazi will be the Minister of Health in the country where she's from, ensuring that women have access to the healthcare services they deserve. all while Amit Salvi will be the CEO of Partners in Health, scaling up and replicating lessons learned from the most grueling parts of the world. Angel Chilwa will be running the Bill and Melinda Gates Foundation, and Coach Alani Sala will have just been on the plenary here because he will be the director of the Center for Disease Control. If one of y'all can let Tom know that tonight, that would be great. These and thousands of other people just like them will be stepping up into leadership positions. And we're excited because 97% of our alums continue to work in global health every single day, with 10% of them reporting directly to the Minister of Health in their country, and 22% of them have already successfully changed policy towards healthcare outcomes. These and thousands of other young leaders just like them will be part of a vital network of thinkers and doers who ensure that healthcare systems serve rather than fail billions. And these leaders who think in a fundamentally different way and who reach across borders and sectors and disciplines to affect change will be in charge. And that makes me very hopeful. In 20 years, accessing high-quality healthcare will be as easy as breathing air because of this crew of leaders who want to work alongside you. Thank you.